So abnormal vaginal bleeding is quite an individual issue. I don't think a doctor or a healthcare professional, anybody who's not that individual, can tell you what is abnormal. You, as a woman, would know what is abnormal for you, and something that is not normal for you is abnormal vaginal bleeding for you. And there are a lot of causes of abnormal vaginal bleeding based on which age group you're in, and other conditions that may be related to it. So, for example, you could have either heavy but regular periods, or you could have irregular periods, and the causes of each is slightly different. You could have associated pain or pressure symptoms when you've got these periods, and the causes for that are different, which means, sometimes you have conditions such as fibroids or endometriosis. Sometimes it may be just a hormonal condition. However, there are some causes of abnormal vaginal bleeding that are of concern. Cervical cancer, for example, within the reproductive age group in slightly older ladies. We are very fortunate to have a really good cervical screening program in the UK, and I would encourage all patients, all women who have a cervix to participate in the cervical screening program, because the whole purpose of that is to pick up cervical cancers very early. But one of the symptoms of cervical cancer is abnormal vaginal bleeding, which may be pain and bleeding after having sexual intercourse, or just bleeding in between your periods. Similarly, women who have stopped their periods completely, what we would say menopause, if they have any vaginal bleeding that is completely abnormal for them, that's not normal. And there is a small percentage of these that could have cancer. These are cancers that are easily cured by surgery if detected early. And therefore, it's really important that women go to a doctor or a healthcare professional if they've got these symptoms, so we can rule these conditions out. So when somebody presents with abnormal vaginal bleeding, a history is quite crucial, because you need to know the pattern of the bleeding. What are their associated medical conditions, such as, have they had a hysterectomy? What type of hysterectomy, and why have they had a hysterectomy? Are they taking any medication? What is their smear history, etc. Once a history is taken, the clinician starts formulating in their head what could be the possible reasons for this presentation. And this will then get followed on by an examination, which will be an abdominal examination, a general examination from head to foot to look for any abnormalities, but crucially, an internal examination, such as looking at the areas down below and putting a little speculum into the vagina, like when you have a smear test, to have a look. Additionally, if the doctor or the clinician, because nowadays we have a lot of advanced care nurses who do this care as well, will take swabs if they think infection is a likely cause. And if you've never had a smear, or you're out of date with your smear test, they will also offer you the opportunity of having what is called as an opportunistic smear. After that, they might organize further investigations, such as an ultrasound scan, which is probably going to be an internal scan, a transvaginal scan, which gives us a better picture of the ovaries and the uterus. And based on that, we may organize any further investigations, or we may suggest treatment. So treatments will depend clearly on what the likely causes of the abnormal vaginal bleeding are. So, for example, if there are fibroids, they're usually just benign tumors of the muscle of the womb, but they can cause a lot of problems, especially with heavy menstrual bleeding. And there are different types of fibroids. So based on the different types of fibroids, the treatment could just be medical treatment in terms of non-hormonal treatment or hormonal treatment. Or you could have surgical treatments as well, such as just the removal of the fibroid, burning of the fibroid, or a hysterectomy, which is obviously a major operation and not something we recommend in the first instance. There are other reasons, such as endometriosis, which obviously have their own treatments, including medical and surgical treatments. There are some conditions that will flag up, and therefore we will investigate and manage them in a slightly different way. And one of them is something that is called unscheduled bleeding on hormone replacement therapy. Now, hormone replacement therapy is getting big media coverage these days for good and bad reasons. Women of a certain age do need hormone replacement therapy to protect their bones, their mental health. A lot of these women are, high functioning women in big jobs, and they need hormone replacement therapy to function normally. However, with hormone replacement therapy, there are associated conditions which can flare up. Or if you're not on the same balance of estrogen and progesterone hormones, you can get abnormal bleeding, which can be a problem. Now, some people would say, why don't you just stop your HRT? It's not that easy when you're actually suffering from menopausal symptoms. So you need somebody to discuss what your hormone treatments are and balance it out so that you have a good quality of life without the disadvantage of having abnormal bleeding.